Hey guys, welcome back to our channel. Have you ever experienced hot flashes, restless nights, mood changes, or symptoms that just seem to come out of nowhere? Maybe you've been wondering, is this normal? Or is there something I can do to feel more like myself again? If you're going through perimenopause or menopause, you are not alone. Millions of women experience changes in estrogen, levels naturally decline. But that doesn't mean you have to ignore symptoms that are affecting your quality of life. Today, we're going to talk about one of the most common treatments discussed for menopause symptoms, estradiol. We'll talk about what estradiol is, why it's used, the symptoms it may help you with, the different forms available, and the possible benefits and risks, and some important questions to ask your doctor. So, if you're navigating menopause or supporting someone who is, make sure to watch until the end. And if you enjoy videos that provide clear, helpful information, don't forget to subscribe to this channel and turn on your notifications so you don't miss future videos. Let's get started here. So, ladies, what happens to estrogen during menopause? To understand what estradiol is, we first need to talk about estrogen. Estrogen, it's just simply a hormone that plays many very important roles in the body. Before menopause, the ovaries, they produced most of the body's estrogen, including a form called estradiol. So we enter perimenopause, the transition period before menopause, usually beginning around age 40ish, carrying on up. Estrogen levels can begin to rise and fall unpredictably, up and down, and level, and then more than likely a slow decline down. And this hormone fluctuation is one reason why many women experience symptoms that feel inconsistent. And one day you may feel fine, and the next day you may be dealing with a hot flash, poor night's sleep, irritability, or just changes you weren't expecting. Eventually, after menopause, the ovaries produce much less estrogen. And for some women, these changes are mild. For others, they can be intense and truly interfere with your daily life. So, what is estradiol? Estradiol is a form of estrogen that is identical or very similar to the estrogen naturally produced in the body. And when used as part of menopause treatment, estradiol can help replace some of the estrogen that has decreased. The goal of estradiol therapy is not to reverse menopause, oh no, or to stop the aging process. We'll talk about aging in future videos. Instead, the goal is to help manage symptoms that may be caused by lower estrogen levels and some women feel more comfortable during this stage of life. It's all about comfort, ladies. So, what symptoms can estradiol help with? One of the most well known is treating hot flashes and night sweats, also called vasomotor symptoms. These sudden feelings of intense heat, sweating, flushing, perspiring, discomfort can happen during the day, at night. For some women, these symptoms are occasional, but for others, they happen many times a day and can be exhausting. Estradiol may also help with symptoms related to vaginal dryness and urinary changes caused by lower estrogen levels. And this may include that vaginal dryness that lubrication just doesn't help with, burning or irritation, pain or discomfort during sex, and certain urinary symptoms. These are real symptoms. Some women also notice improvements in sleep when their night sweats and hot flashes improve. And it's important to remember that every person responds differently. A treatment that works well for one person may not be the right choice for another. You do have options, which is why, again, you must talk to your healthcare provider. So, let's talk about the different types of estradiol. One thing many people don't realize is that estradiol comes in different forms. It comes in patches, which are placed on the skin and release estrogen gradually. Pills, which are taken by mouth and has a more systemic effect. Gels or sprays, which are applied directly to the skin. And there are vaginal estrogen products, which are designed specifically to treat and target vaginal symptoms. The type you use depends on your symptoms, your preferences, and whatever is recommended by your doctors. There's no single best option for everyone. It just, again, depends on what you need. Now, some people ask, do I need progesterone with estradiol? Well, that's an important question and it often comes up. If someone still has a uterus and uses systemic estrogen, a healthcare provider may recommend adding another hormone called progesterone or progestogen. Why? Well, because estrogen alone can stimulate the lining of the uterus. Adding the progesterone helps protect that uterine lining. However, whether or not you need it depends on your individual situation, and it also matters whether or not you had a hysterectomy. So, this is one of the many reasons why it's important to discuss the pros and cons of hormone therapy with your medical professional. But let's talk about the benefits and the risks here. Because, like any medication, estradiol has both potential benefits and potential risks. For some women, the improvement in symptoms can be life changing: better quality sleep, fewer hot flashes, relief from uncomfortable symptoms. However, hormone therapy is not appropriate for everyone, and I do want to stress that. Certain medical conditions or your personal health factors can affect whether estradiol is recommended. Now, of course, these are concerns to discuss with your doctor because factors such as your age, when your menopause symptoms began, your medical history, your family history, and your risk factors for certain conditions. However, the decision to use estradiol should always be a personal choice. Don't do it just because your friend's doing it or you heard about it just because of this video. There are many factors to consider. But some of the questions that really you should be asking: is estradiol safe? Again, safety depends on the individual. Many women do use hormone therapy safely when it is carefully chosen and when it is carefully monitored. But the benefits and the risks need to be discussed with a healthcare provider. And I would strongly recommend you do that with an established healthcare provider versus just ordering a product virtually from a doctor who doesn't know anything about you. How long can someone take estradiol? Well, again, there's no single answer for everyone. Treatment length depends on your symptoms, your goals, your health history, and ongoing discussions with your provider. Although there have been longitudinal studies regarding hormone replacement therapy, and it is typically recommended that hormone replacement not continue for longer than 5 years, with having increased risk of cardiac conditions and stroke. Does everyone need hormone therapy? No, absolutely not. Some women choose to use hormone therapy and others find it very helpful. No, it's no big deal. But the right decision depends on your personal experiences and, of course, your medical situation. How comfortable or uncomfortable can I use over the counter remedies, etc.? Or is adding this to my wellness program something that I would like to consider? So, but do consider lifestyle support during menopause. That includes eating healthy, exercising, relaxing, and trying to get as much rest as you possibly can. While treatments like estradiol can be helpful, lifestyle habits are really an important part of your menopausal care. Truly, regular exercise can support your bone health, your heart health, mood, and energy levels. Strength training, especially important. It doesn't mean you have to bench press your body weight, but using 5, 10 pound weights can affect your bone density over time. Having a balanced diet, quality of sleep, stress management, and staying connected with friends and loved ones can really make a big difference. I also encourage communication with your partner, especially if you're still sexually active. Having these discussions about intimacy and the changes that you're experiencing because of menopause or perimenopause, it's very important to clue your partner in as well. So, menopause is not just about managing symptoms, it's about supporting your overall health now and for the many beautiful years ahead. So, if you're considering estradiol, here's some questions you may want to bring to your appointment when you speak to your doctor. What symptoms could estradiol help me with? Which form of estradiol would make the most sense for my situation? Do I need progesterone? What are my personal benefits and risks? How will we monitor my treatment? And what other options should I consider? So remember, your healthcare decisions should be a conversation. You deserve for the doctor and you to take the time to understand your options and to feel comfortable with whatever treatment plan you do decide to engage in. So remember, ladies, menopause, it's a natural transition. We don't talk about it enough, and there are too many secrets around it. But struggling with symptoms doesn't have to be something you just simply endure. That's nonsense. Estradiol is one option that may help some women manage symptoms and improve their quality of life. The most important thing is finding an approach that fits your body, your health history, and your personal goals. So, if you found this video helpful, please give it a thumbs up, subscribe to the channel, and share this information with someone who may benefit from learning more about menopause. Remember, always talk with your healthcare provider. This was informational and educational and not a replacement for any type of medical care or treatment. So, I appreciate you. Thank you for watching. Watch my other videos for more inspirational wellness tips and just happiness. I'll see you in the next video, and until then, you be well.